Welcome to Innovation and the Future of Pharmacovigilance, a podcast series brought to you by Truliant Talks. I'm your host, Indy Alawalia, and I'm delighted to navigate the dynamic world of pharmacovigilance and risk management with you. However, with this being a special episode featuring the co-founders of Truliant Consulting, I have a little disclaimer. While their views may be expressed, please note that any mention of vendors, products, or services should not be taken as an endorsement. Instead, we encourage you to view the information holistically, considering your department's goals and requirements when evaluating any recommendations. Today, we're taking an in-depth look at the events that have shaped the landscape of PV and risk management in 2023, and we consider the predictions for the year ahead. I'm delighted to be able to introduce to the stage the co-founders of Truliant Consulting. Hi, everyone. Welcome to the podcast.
Hello.
Hello.
So today is a very unusual format. It's a special episode. And really what we're talking about today is what happened over 2023 and what you think will happen in 2024. 2023 was a big year. There were so many things going on in the world of PV. I think the first thing that I'd like to get out of the way is the technology aspects. Sorry, there were so many things going in with regards to AI, to new vendors, to just the amount of stuff happening. Every single conference was a buzz with AI. What were the big things that stood out to you in 2023?
Hi, everybody. I think to me, 2023, as far as technology in PV is concerned, was a pivotal year. And I say that because it's been close to a decade since we've been talking about we need to shift from the legacy technology into the new world. We've been hearing about a lot of vendors, big, small, trying to innovate, trying to disrupt. But up until 2022, we've mostly heard about failures. We've mostly heard about companies trying to or companies attempting to implement a certain piece of technology, whether it's software, whether it's an individual technology trying to improve on efficiencies within their PV department, and likewise. But in 2023, we saw some clear shift happening with respect to successes that companies have started to taste, as well as I think 2023 is the pivotal year with respect to laying the foundation for what lies ahead of us. There are many small vendors, big vendors that have come up and are presenting options for pharmaceutical companies across the landscape to pick and choose from. And I think that is good. We've clearly moved away from largely a two-vendor play legacy technology into a world where there are a lot of innovators who are trying to disrupt and really bring in the new technology. As far as AI, etc., is concerned, I still feel there's a lot more that needs to happen for the industry to feel comfortable with the technology and use it day to day. But the foundation really has been laid, and we've seen a lot of tools. We've seen products that are starting to show the promise as compared to what it was in the past. So I think with that regard, 2023 really lays down the foundation for next 5 years. and some of the decisions that companies have made, big, small, large pharma companies, CROs, we will see in 24, 25. And I'm confident with the amount of time that these companies have spent that we will see an accelerationist change. I think the industry was changing irrespective over the last 5 years, but it's really going to pick up momentum starting now.
And and it's not necessarily just the safety database as well. There's other technologies around. Rosa Ishan, I know that there are just some very unique software ideas coming from some of these vendors.
For sure. I think I agree with Saurabh's point that 2023 has been a pivotal year. There's been huge advancements in AI technology outside of PV, and people are very excited to be experimenting with these new technology, especially with large language models. And although as you said, not just the core safety database, but there are other technology tools like literature screening or regulatory intelligence tools that are out there that take advantage, not necessarily large language models, but some AI technology that are currently either being experimented or being used in the industry. That's very exciting. So I think we'll see more of that in 2024.
Yeah, and to add to that, I think in terms of the buzzwords that we've heard in the last few years, which are actually shaping up or have shaped up in 2023, the AI area has developed significantly outside in different industries. Our industry, pharmacovigilance, is very controlled and requires a lot of controls from the authorities and the companies before you can drive those innovations as solutions, because everything impacts patient safety. So a lot of these ideas and innovations coming from the core development of the technology across the industry is actually starting to show up in 2023, and there'll be a lot more focus in 2024 looking at how these technologies can be put in place with the right controls in place, ensuring there is no impact to patient safety. And on the other side, there is improved efficiency in driving and capturing that data as well. And one of the other things that was also in focus in 2023 is the talk about interoperability of systems. We briefly touched upon it as well. It's not just the safety database anymore, it's the entire landscape. And with the ability to capture data in so many different aspects, we have wearable technology, we have data getting collected from all different sources, not just safety sources, but other clinical sources as well, patient registries, and people have the ability to provide information in social media and capture the data from social media as well. So while you're collecting data from different platforms and bringing it in, there is this need to make it useful and find out novel signals where possible, and of course make those systems much more efficient as well, and make that data available for the larger teams to make good decisions and safer products. So yeah, we'll see a lot more focus on that in the coming months and actually in the coming years as well. But this was one of the foundation years, as very rightly pointed out by Saurabh and Rosa.
I think what you're talking about, social media, there hits a point. And actually, we know that there's going to be new regulatory guidance, E2D, coming out next year. But interestingly, on the technology side, big things have happened in the last couple of years. Specifically, only very recently, a few days ago, at the time of recording. RX Logics has obviously signed up with with EMA to be a technology partner. We have the MHRA with Insight. It's a fascinating time, and it's obvious that regulatory agencies are now actually looking at this technology and incorporating it, and thinking about the regulations that will be happening. From a regulatory aspect, what else has happened in 2023? Like I said, we know about E2D next year. Lacey, Emma, was there anything that highlighted that was highlighted this year that you thought was an interesting step from the regulators?
I think not necessarily from regulators, but from the CIOMS working group. There was CIOMS 11 that was published, the working report that emphasized patient involvement throughout the development of a medicinal product all the way through post-marketing, and making sure through the life cycle of the product that the patient voice is, you try to seek the patient voice, you incorporate the patient voice. And so I think that was a great report in the sense that it really highlighted and underscored the importance of utilizing this really critical patient feedback to inform a lot of activities. I know we had done a survey where we were looking at how patient feedback was used and leveraged with regard to benefit risk activities. And but it encompasses many different facets of in clinical trials, post-marketing, et cetera. So it was really interesting to see the report, and I think moving forward really lights a fire. I think a lot of organizations understand the importance of collecting this information, but I think that there's a ways to go as far as proceduralizing, operationalizing that, to make sure that it's actually happening and that patient voice is being sought consistently, to make sure that these, from a risk management perspective, for example, risk minimization tools are really fit for purpose. So I think that I'm looking forward to seeing how organizations evolve and incorporate this type of approach to better inform their risk management activities.
And one thing, sorry, Andy, I also wanted to add something on regulations. I think up until a couple of years ago, you of course had the FDA, the EMA, and MHRA in Japan, and then there were other agencies. I think for the last 3-4 years, what we've seen is that some of these other agencies are evolving and coming up with their own unique regulations, which is only adding to the complexity. So came along South Korea with their own unique set. Then we started hearing about China. Now last year, the South American countries, Mexico. I mean, they are, I think, taking the initiative and coming up with what they want rather than just following a specific standard, which is leading companies to think about how can you efficiently serve. If you're a large company, you're pretty much reporting everywhere, and that one standard that existed before doesn't exist anymore. So it's not only the system that needs to be able to adapt to these rapid changes, but also from a process perspective, you really have to be on your toes, because the world is evolving very fast, and you will continue to hear of countries that will come up with their own unique set of regulations, and you'll need to adopt very quickly to that.
Yeah, and I can add, I don't know, Emma, maybe you were going to add, but I'll just say briefly, another area completely different, right? We've had our eye on the IND rule, the proposed IND rule. We're watching, we're waiting to see if that goes into effect. That puts a lot of burden, especially on smaller companies, for aggregate safety analysis, some ambiguity there. So part of the fun of 2023 has been watching and waiting to see where some of these things are going.
Yeah, and I was just going to add really about IDMP. So it's been talked about for a little while, and companies have been thinking, oh, it's going to come, but it hadn't come to fruition yet. I think in 2023, when we went to things like the EMA Information Day and other conferences, it was actually starting to make more noise again. So I think we will see changes come, and I think they'll come soon, and they're in 2024, and it's not that long way off in the future that we've been thinking about for a while. So I think that's been talked about a lot this year.
Yeah, I think that's absolutely fascinating. That is what is happening. With regards to, maybe let's take a step back away from PV a little bit and look at the life science companies in general. It's been a big year for divestments, I think, again, just a few days ago from the time of recording, I think there is one massive a massive merger happening with Pfizer and Seagen. What's going to happen in 2024? What do you think is going to happen in 2024? Because these are some major divestments and mergers happening.
Yeah, I would speculate more, a couple more big ones perhaps ahead next year. We're definitely seeing a trend toward the occasional massive acquisition integration, and we are seeing a trend of the larger companies. This is not news, right? Buying up a lot of the little guys. We see it happen all the time, and I think that trend will continue. I think some companies are more ready to go spend. Some perhaps are not. We're seeing spending. We're seeing contraction. We're seeing all of it.
Yeah, and I think we've done a lot of work with companies that are stripping down and leaning up, either to prepare for an acquisition or to prepare for a big, takeover. So we've done a lot of work in helping companies strip down and get prepared, ready for these large either acquisitions or divestments that we've spoken about.
Yeah. And I guess I'll add to that, indeed, and then I know you want to go on to something else on the total other end of it. We see these really small companies that are thinking, are we growing for a year or so to be acquired, or are we growing to commercialize our products? Sometimes they don't know. And it's been very interesting and I would say rewarding to help them to figure out how to handle that in between period, right? Because they don't have unlimited money to spend, but they do have to be compliant and they do have to make sure that they are in good shape and they're sustainable.
And I just wanted to, sorry, go ahead. I was just going to add, okay. Right, go ahead, Rosa.
I was just going to add that from the perspective of acquisitions or mergers and acquisitions or going to market, we're finding more interesting and more creative ways of partnering across companies to take products to market. And that creates, it's great commercially for the companies, but that also creates challenges and unique, newer challenges for the pharmacovigilance organizations to make those happen and figure out ways to stay compliant within the new partnership setups.
Thanks, Rosa. And I was just going to add, in terms of the other aspect of this whole M&A spectrum and the divestments, of course, there are these large ones that will continue to happen. But there is this aspect of smaller product and portfolios getting divested across the industry. Smaller companies buying up products to create their portfolio, larger companies divesting their or leaning out their portfolio in focused areas of therapies. So in that aspect, there is this efficiency coming into focus, or drive towards efficiency coming into focus, where companies are trying to create separate either teams or project teams or departments, not just to overburden the existing core functions that deal with the regular pharmacovigilance activities, but there is a lot of focus on creating the machinery around making some of these divestments happen in a regular fashion without just overwhelming the existing core functions in the PV. So there is this area that is growing, and we do a lot of work. We've done a lot of work in the last year, and we see this continuing in the coming year as well.
Totally agree.
So that's taking the sort of the sort of larger view on everything. But something Jamie mentioned, and actually there's a connection here to technology as well, is that the smaller companies that may only have one or two sort of products that are just potentially just coming out to market, again, there's this link with the regulations as well that Sarah mentioned, the fact that we have these agencies all over the place now. It's no longer just the big three. We've got these smaller ones, and we've got these small companies coming into the PV world, post-marketing world, and suddenly they have regulations which are no longer aligned. They're starting to sort of unalign themselves. Mm-hmm. Do you think 2024 will be a big year for these smaller companies just trying to understand where these regulations are going? It's very different when you're at the top 25, where you can have a whole department on that.
Yep.
How are these smaller companies going to be able to cope with it, I guess?
I can give a brief answer, and I know others will have more views to add. They're going to have to rely on external support because it's not possible otherwise to keep up, right? All the subscriptions to all the regulatory intelligence in all the world, you still need help and guidance. So, I mean, we all know that these smaller companies outsource heavily. We think they'll continue to do so, but we know they're going to need to rely on additional, I would say, consultative and advisory support, and just that right level of support to balance, right, their needs against the resources available to them. So it's a challenge, right? Being in these small companies is not easy. Anyone else?
I was going to add as well that is also probably what's driving some of the creativity when it comes to the partnerships as well. So in areas the small companies don't have coverage, they'll look for other parties that can help to take their product to market as well. So and that creates complexities for both the smaller company and the bigger companies, or companies that do have presence in those other markets.
Yeah, and actually, Rosa, now that you mentioned that, I'll elaborate even further on where my head was going. Is creativity not only in outsourcing day-to-day services, but finding a licensed partner, making sure they're a good licensed partner. Right? There's a lot of things that are now core skills that you have to have that didn't used to be necessary core skills. And I think even to what Ishan was saying before about divestments, companies are having to become good at things and have capabilities and skills that 10, 15 years ago wouldn't have even been on the table, right? Big companies now have to be good at acquiring small companies, right? That was never a thing that they had to have a dedicated function for. Small companies have to be really good at being a small company, which means something very different now.
The skill sets that are required to be in a small company is probably vastly more complicated than it is to be in a larger organization where you're in just a singular department, being able to do one thing or a few things rather than a multitude of things. Yep. This year has been a massive change, I think, in the way that companies have hired. Obviously, technology is there to push things out to be outsourced, which outsourcing is not new. But do you think that the skills that are required from new employees is changing, or even existing employees? Emma, you did a fantastic webinar just a few weeks ago about the culture aspect of change management. But from a skills point of view, is there a big change?
Yeah, I think there is going to be a big change, but that's not to say that the people that are in positions now can't develop the skills required. I just think that there will be a lot of upskilling needed. We're now going to, if we think about what technology is going to help us do, I think we're now going to have larger volumes of data. And like you said, we need to look for data analysts and more data scientists to help us understand our products better from the amount of information we're getting, rather than that attention to detail to single cases, or even when we're doing signal detection, we haven't had huge volumes of data that we might be seeing if we move into that data trawling on the internet and taking more information that we scan from literature and things like that. I think we're gonna need to have a slightly different skill set. But I'm not saying that we need to change our personnel, but we need to upskill or change the skills of the personnel. I don't know, in an RMP, from a risk management perspective, do you think things will change with bigger data and we'll need to change the data set in that area as well?
Yeah, absolutely. I think it's sorry. Making sure again that it's understanding of that bridge between signal detection, kind of flowing into risk management, and making sure, I think, especially when you were mentioning smaller organizations, just really making sure that the individuals kind of have this holistic view and understand again sort of where the information is coming from, how that information flows from signal detection, signal management into risk management, risk minimization. But I think from a skills perspective, yes, as the data changes, that it's going to be necessary to understand your sources of information. And again, as the sources evolve, it's going to be very interesting to see individuals and kind of how they upskill in that space.
I liked the fact that you had just touched upon data and big data. Circling back to again the tech aspect, there's been, I think, for the last 2 years, this warning coming to PV, which is big data is here and it's something that needs to be tapped into. But what's the reality of that, Ishan? Like, can PV departments actually tap into this big data from Truly, and the information that they're tapping into? Can that actually help in what is the ultimate goal, which is making sure that these products are safe for patients?
So it's still in an area where the technology is meeting or getting to that place where you can start evaluating. You can imagine. I'll give you an example. We have as many data sources as we can have to intake patient safety data that we didn't have before, right? Social media is one of them. Wearable devices, patient registries, clinical sources, as well as call centers. Of course, a lot of these were there earlier. But then when you are capturing data in all of these areas, how do you make use of it where that data makes sense to the right departments at the right place, real world data that can make sense to the departments at the right time at the right place, and they can make use of it in, for example, finding novel signals, which you otherwise wouldn't find if you just look at the safety data in a silo, right? So there is this push from companies to evaluate and understand how can they holistically look at data, bring it to a platform, bring it in a format or in a standardized way where electronic health records from hospitals can be, for example, stored along with safety data, along with clinical data, and you have a seamless connection. There have been innovative ideas that have been shared earlier. We haven't touched upon it in our industry in great detail, but the blockchain technology has been around for quite a while, right? And it has its own benefits in providing data security, data privacy, and decentralization of, for example, private patient data in a sense. So health authorities are a good example who can evaluate blockchain technology to make patient data available, yet make it available securely, as well as decentralize that information which users can tap into. So there is a lot to look into. There is a lot that is happening in terms of evaluation. We are at the evaluation stage, I would say, at the moment. 2024 will see a lot more of focus in the interoperability of it, and in a sense driving the integrations with some of these systems and departments.
I think too, from a risk management perspective, I liked what you said about just the right data at the right time, and making sure that cross-functionally departments have their own sort of data sources, data sets, and it's so critical for there to be communication and sharing of the appropriate information across. And I know, from clinical from health economics, outcomes research. It's just, each individual sort of function, making sure that they're at the table, that they are present to communicate and share this information in a timely manner, it's so critical. I think, there's some opportunities there to make sure that the data is shared at the right time.
And I think
I think, go ahead, Jamie.
I think one of the things that technology can do is help us get access to our data quicker. So we're able to make a judgment about our product and the safety of our products much faster than we would have been able to before. So it's not just about the volume of data that we can consume, it's about how quickly we can get access to the data as well. And I think technology will help us to do that. Mm-hmm. And sorry, Saurabh, go ahead.
Yeah, I think I came into this industry in 2003, and it was in 2007 or 2008, as part of a conference where we were trying to do an integration between EHR and safety. So this concept has been there for quite some time. I think this is an area where I will be critical of the world of PV and the people involved in it, because I think we've been very slow here. And I, despite of the technology being there, I still feel this is an area that it's not going to really, we're not going to see disruption very soon in this area. I think within the confines of the PV landscape, a lot is happening. And maybe this is a more natural or a logical curve for this to evolve and to be better ready for seamless integration with some of the areas that Ishan was talking about. I think that's a great vision, and that is where we should be headed. Maybe what's happening in the world of PV right now with the changes in technology that we were talking about will set the foundation for us to move there. But I think it's going to be a long run and a very challenging process, because it's not just about technology. I think this is going to disrupt how people work within life sciences, not just safety, and that's a huge barrier in my opinion. But we'll get there. It's just going to take time.
And I think this year, in terms of talking about technology, in the past years, there's been a lot about advancements of technology and what we can automate. I see that this year, that theme has shifted to not only how can we automate, but what is the human factor within all of these changes. And some of the themes that we're trying to evaluate and understand how we can interact with AI, and how central that human verification, or how do we know that it's telling the truth, whether AI is telling the truth. That's a huge question that's being grappled with within especially patient safety, where accuracy and truthfulness of the information is sacrosanct. So again, technology has been a big theme, but human interaction with technology has been more and more pronounced in terms of as a central part of discussion. And then going back to Emma's point about, then we need to change the way how in terms of how we work. It's not that automation's removing people from the process. We're just changing how humans work within the 2B world.
Right. And I would add to that, it's also making sure that people have confidence, because the data could be there. You could have done all of the right tests and verifications, but just like with any digital transformation or whatever you want to call it, engaging people so they feel they're part of it and they trust it, because it could be trustworthy, but if people don't trust it, you still have a problem. Mm-hmm. So all of that still as well. Go ahead, Em.
Yeah. Oh, sorry. No, so I think from a REMS perspective, I know there's a lot of talk at the moment just about how to reduce the burden on the healthcare system with some of these requirements. It can be viewed as onerous, and I think leveraging technology to try to kind of integrate as much as possible into the pharmacy system, healthcare system, et cetera, acknowledging REMS requirements, in the electronic health records, as opposed to having to make, someone go somewhere else to acknowledge that they've completed their training. So I think that as far as what you were speaking about, Rosa, humans kind of interacting, but there's the technology piece. Yes, you can have that integrated to reduce that burden, but then it's also training and making sure that the REMS stakeholders know how to interact with that technology to really make it the most efficient and to really increase the uptake.
So the title of this podcast is Innovation and the Future of Pharmacovigilance. So there's 6 of you, so I want 6 predictions for 2024, please. What do you think is the big thing next year, and specifically next year? I'm going to start with Emma.
Well, I think earlier on in this conversation, I had mentioned IDMP, so I think I'm going to be keeping an eye on that. And I think that will happen, or we'll at least get more guidance on what's going to happen in 2024 around IDMP.
And Lacey, what do you think?
I think sort of coming back to what I had mentioned earlier about the patient piece, I think there's going to be a lot more focus on integrating this type of information and feedback into the process for risk management. And so I think there's a lot of chatter and there's a lot of awareness that this needs to occur. So I think there's going to be a lot of focus on ensuring and building processes to ensure standard and consistent collection of this information. I think that's probably where I want to be focused and kind of making sure that that's progressing.
Saurav, what do you think for 2024?
Actually, I believe 2024. Okay, let me put it this way. I believe the sort of thing that we're looking for technology will not happen in 2024. I think it will happen in 2025. I think 2024 is going to be an year of experimentation, a lot of trials, some success, some failure, and the whole industry, including the vendors, are going to learn from it, and then you'll see a lot of big successes in terms of shifts from the legacy systems into the modern world of technology start happening in 2025.
Ishan, what's your big prediction for 2024?
One of the areas that I'm looking forward for more actually guidance and information from the health authorities is the controls and how these new technologies should be tackled into the industry. So these vendors and this vision that we're talking about, I totally agree with Saurabh. 2024 probably is going to be the year of experimentation, identifying what technology fits in where. But I'm looking forward to it is in terms of that finding out the right kind of guidance and how to validate AI, for example, is one of the very hot topics. I'm hoping that there will be more focus from the authorities in this area in 2024.
Jamie, what's your big prediction for 2024?
Well, Saurabh stole my answer. I agree with him. I would add to that, maybe it's not a massive prediction, but a prediction is there's a lot of other smaller, tech solutions that are out there to solve niche problems that some of the larger and up and coming systems don't necessarily tackle. So what I'm hoping to see is a little more traction in and maybe some early moves in those areas so that we can again learn from how those are uptaken, how they fit into the ecosystem. I think what a lot of them have in common is they are innovative, they're more modern technology, they're more flexible, so they should fit in, right, to the future landscape. So I would like to see, and I'm hoping to see some traction and trends there. But I agree with what Saurabh said. It's 2024 is the year to experiment, see what works, see what doesn't work, and then we'll talk about 2025 a year from now.
Finally, Rosa, how do we wrap up 2024?
Saurabh stole my answer as well, but that's where I think. But I'm going to say something more provocative, because a huge disruption in 2023 in terms of large language models. I don't know what it is, but I think the pace of change is starting to pick up even more. So as companies are grappling with experimenting with what's available now, some other big disruptor is going to happen outside of PV in terms of technology improvements that's going to, I don't know, make us spin around a little bit about the experiments that we've been doing, and then take a look at the more disruptive available technology that are coming out.
I was hoping we wouldn't get near ChatGPT, but it took exactly 40 minutes to get to ChatGPT. Absolutely fantastic. Right. Thank you, everyone, for joining us on this podcast. I'd just like to say, on behalf of Truliant Talks and Truliant Consulting, we hope you have a fantastic 2024. And if you ever wish to contact any one of us about any of these fascinating conversations, then please just reach out to us on LinkedIn, or even just send us an email. We'll be pretty happy to get emails. Thank you, co-founders, for joining me today.
Thank you, Andy.
Thank you.
Thank you.
Holidays.
Yeah.
Yeah. Happy holidays. Yeah.
Thank you.
Thank you, everyone.
Bye.
Thank you. Bye-bye.